Hello friends, welcome to my YouTube channel that is Study with TT. In this video series that is Lacrimal Apparatus Part 2, we'll study about Dacryocystitis and swelling of the lacrimal gland. So let's start with the Dacryocystitis. Now, Dacryocystitis is inflammation of the lacrimal sac. It is of two types, congenital Dacryocystitis and adult Dacryocystitis. Now let us study the congenital Dacryocystitis. It is chronic inflammation of the lacrimal sac which is occurring in newborn infants. What is its etiology? It is due to congenital blockage in the nasolacrimal duct. Most common, there is membranous occlusion at its lower end, whereas other causes of the congenital blockage of nasolacrimal duct could be epithelial debris, complete non-canalization. Rarely bony occlusion can also cause the blockade. There are some bacteria which cause congenital Dacryocystitis, namely Staphylococci, Pneumococci, Streptococci, Haemophilus influenza. Now, what are its clinical features? So, it is characterized by epiphora, that is watering eye due to blockade. There is positive regurgitation test. What do you mean by it? We have studied it in last lecture that when pressure is applied over the lacrimal sac area, there is mucopurulent discharge which regurgitates from the lower punctum. There could be swelling on the sac area as its characteristic feature. What is its complication? It could be recurrent conjunctivitis, acute on chronic Dacryocystitis, lacrimal abscess and eventually fistula formation. Remember friends, there is a differential diagnosis of congenital Dacryocystitis, that is ophthalmia neonatum and congenital glaucoma, because in this too also you see epiphora. Now let's discuss the treatment. First of all, you will do massage over the lacrimal sac area. Now how will it help? Remember friends, the massage will increase the hydrostatic pressure in the sac, which will eventually open up the membranous occlusions. Second method is probing of the nasolacrimal duct with Bowman's probe. While performing this technique, you have to take care that you don't injure the canaliculi. Third technique could be balloon catheter dilatation in cases where the obstruction seems to be due to scarring or constriction rather than merely by distal membrane. Fourth one could be intubation with the silicone tube. And last option is dacryocystorhinostomy operation. Now let us discuss adult Dacryocystitis. So again, it is of two types, acute and chronic. Here, chronic Dacryocystitis is more common compared to acute. Now let us discuss chronic Dacryocystitis. Remember friends, it is a multifactorial disease and the etiology is as follows. It could be age, sex, race, heredity, socioeconomic status, poor facial hygiene. Now how does heredity play a role? It has an indirect role by affecting the facial configuration and so the length and width of the bony canal. Females are more affected because of the comparatively narrow lumen of the bony canal. Other cause could be stasis of the tears in the lacrimal sac. Now this stasis could be because of various reasons such as anatomical factors causing the blockage, foreign body causing the blockage, excessive lacrimation, recurrent conjunctivitis causing blockade by epithelial debris, obstruction of the lower end of the nasolacrimal duct by polyps, hypertrophied inferior turbinates, etc. Now, what could be the source of infection to the lacrimal sac? It could be conjunctiva, nasal cavity, paranasal sinuses. What are the causative organisms? They are Staphylococci, Pneumococci, Streptococci, Pseudomonas, etc. Rarely tuberculosis, syphilis, leprosy may also be responsible. Now, what are the clinical features of chronic Dacryocystitis? They are divided into 4 stages as follows. The first stage is a stage of chronic catarrhal Dacryocystitis. The only symptom in this stage is watering eye. The second stage is the stage of lacrimal mucosal. Along with watering eye, in this stage you will have swelling just below the inner canthus. Now, if this swelling blocks the canaliculi, the mucosal gets converted into encysted mucosal, giving negative regurgitation test. The third stage is the stage of chronic suppurative dacryocystitis. Now, in this stage, there is pyogenic infection which converts the mucoid discharge into purulent. If this purulent discharge blocks the canaliculi, it will cause encystate pyocele. The fourth stage is the stage of chronic fibrotic sac. Here, the sac becomes small in size due to thickening of the mucosa. This is the photo showing the second stage of the chronic dacryocystitis, that is lacrimal mucosal. It is associated with a swelling just below the inner canthus. Now let us discuss what is the complication and treatment of chronic dacryocystitis. So let's start with the complication. It could be intractable conjunctivitis, ectropion of the lower lid, chances of corneal ulceration, high risk of developing endophthalmitis. Now, what could be the treatment? The conservative treatment being probing and lacrimal syringing. There could be use of balloon catheter dilatation. You can do dacryocystorhinostomy or at last dacryocystectomy. The indications for dacryocystectomy include too old patient, fibrosed sac, tuberculosis, syphilis, leprosy or mycotic infection of the sac, tumors of the sac, atrophic rhinitis. Last option being conjunctival dacryocystorhinostomy. It is performed in presence of blocked canaliculi. Now let us discuss acute dacryocystitis. First of all, we'll study its etiology. So, acute dacryocystitis can develop in two ways. First being an acute exacerbation of chronic dacryocystitis. Second one is an acute peridacryocystitis, that is due to direct involvement from the neighboring infected structures such as paranasal sinuses, surrounding bones, dental abscess or caries, etc. Let us discuss its clinical features, which are divided into three stages as follows. First stage, that is stage of cellulitis, which is characterized by painful swelling in the lacrimal sac area. Second stage being the stage of lacrimal abscess, and the third one is fistula formation. Remember friends that the lacrimal abscess, it usually points below and to outer side of the sac because of gravity and the presence of medial palpebral ligament in the upper part. This picture shows the second and the third stage of acute dacryocystitis, that is the stage of lacrimal abscess being the first one and the stage of fistula formation the second one. Now let us discuss the complication and treatment of acute dacryocystitis. The complications include conjunctivitis, corneal ulceration, lid abscess, osteomyelitis of the lacrimal bone, orbital cellulitis, facial cellulitis, rarely septicemia or cavernous sinus thrombosis. Now, what could be the treatment? So, the treatment of first stage, that is the stage of cellulitis, include topical or systemic antibiotics, anti-inflammatory and analgesic drugs to control infection and relieve pain. The treatment of second stage, that is lacrimal abscess formation, is treated by incision and drainage. The treatment of third stage, that is the stage of lacrimal fistula formation, is treated by fissulectomy along with dacryocystectomy or dacryocystorhinostomy operation. So now, let us discuss what is dacryocystorhinostomy. So it is a type of drainage procedure in which the lacrimal sac is opened up into the medial meatus for its drainage. There are various techniques to perform this operation, which are conventionally external approach, endonasal approach, which could be either endonasal surgical or endonasal laser. The fourth being endocanalicular laser approach. This is the picture showing the surgical steps of external dacryocystostomy operation. Now let us discuss the last topic, that is swelling of the lacrimal gland. First is dacryocystitis. Now it means inflammation of the lacrimal gland. Now dacryocystitis, they are of two types, acute and chronic. Let us discuss the acute first. The etiology for acute dacryocystitis is either the primary inflammation of the gland or secondary to some local or systemic infection. The clinical features are based upon which part of the gland is affected. For example, if the palpebral part is affected, it is characterized by painful swelling in the lateral part of the upper lid showing a S-shaped curve. If the orbital part is affected, it will form painful proptosis in which the eyeball moves down and in. The treatment involves systemic antibiotics, analgesic and anti-inflammatory drugs along with hot fomentation. If there is pus collected, you have to do incision and drainage. Now let us discuss chronic dacryocystitis. It is characterized by engorgement and simple hypertrophy of the gland, the etiology being acute inflammation or associated with chronic inflammation of conjunctiva, or due to systemic disease such as tuberculosis, syphilis and sarcoidosis. The clinical features being painful swelling and ptosis in which the eyeball may be deviated down and in. This picture shows a S-shaped curve in both the upper lids because of affection of the palpebral part of the lacrimal gland in case of acute dacryocystitis. Now let us discuss the second swelling, that is Mikulicz syndrome. It is characterized by bilaterally symmetrical enlargement of the lacrimal and salivary gland associated with variety of systemic diseases. The third swelling being dacryops. It is a cystic swelling which occurs due to retention of the lacrimal secretion following blockade of the lacrimal ducts. Now last is, let us discuss the tumors of the lacrimal gland. They are of two types, epithelial tumors and non-epithelial tumors. The epithelial ones are either benign or malignant. The non-epithelial are either lymphoproliferative or any inflammatory condition giving rise to tumor, such as idiopathic orbital inflammatory disease, sarcoidosis, etc. Now let us discuss a type of epithelial tumor of lacrimal gland, that is pleomorphic adenoma. It is also known as benign mixed tumor. It is a slowly progressive and painless tumor. It is locally invasive and may infiltrate its own pseudocapsule to involve the adjacent periosteum. Histologically, it shows the presence of pleomorphic myxomatous tissue. The treatment is complete surgical removal along with its capsule. Let us now discuss the malignant epithelial tumors of the lacrimal gland, that is lacrimal gland carcinomas. They are of four types: adenoid cystic carcinoma, pleomorphic adenocarcinoma, mucoepidermoid carcinoma and squamous cell carcinoma. The clinical feature being painful mass, associated sensory loss and paresthesia in the region supplied by the lacrimal nerve. CT scan shows an infiltrative tumor molding the globe. Treatment includes complete macroscopic excision and high-dose radiotherapy to the orbit. I hope you liked my video. Do like, share, comment and subscribe to my YouTube channel, that is Study with Didi.